What's going on, everybody? It's Dr. Matt from Pinnacle Chiropractic, your local pediatric, prenatal, and family chiropractic office here in the Lakewood Ranch, Sarasota, Bradenton, Florida area. And today's video, we're going to talk all about proprioception. So the term proprioception, it's not an everyday term that's familiar to most parents, but it certainly is if your child has struggles with motor tone and development, a weak core, delayed walking or talking, sensory processing disorder, even autism spectrum disorder, or maybe even ADHD and anxiety, because at the core of all those neurodevelopmental challenges in kids are issues with proprioception. So this also means having a good understanding of what proprioception is, how important it is to the developing brain of a child, and even for us as adults as well, and how it gets thrown offline and out of whack by early childhood stressors and injuries that come as the result of birth interventions like C-section, induction, forceps, and vacuum-assisted deliveries. Is super important for parents. So this video is specifically for parents of children who are struggling with any of those issues that I already mentioned that have to do with motor function, tone and coordination, sensory processing, speech delays, and so forth. And it's most especially for parents who have already had their children in the common therapies like PT and OT and speech. And especially if they've already plateaued or maybe not seen results, or just not seeing the results as fast and as complete as you'd like. So in this video, we'll really break down proprioception, motor tone and development, and the role that this vital function plays in sensory processing, behavioral and emotional regulation, focus and memory, and so much more. So we take care of a lot of kids and have seen a lot of big improvements with kids with low motor tone or low tone, low core muscles, kids on the spectrum, sensory processing disorder, and seen a lot of big improvements with their proprioception because, as we'll talk about here a little bit more in proprioception, is a lot of the proprioception comes from our spine alone. So proprioception is really our body's sixth sense. It sends information and input into the brain about the body's position, where we are in space, for things like movement, spatial orientation, coordination, motor tone, and so much more. And this is an unknown thing, but it's really, really important. While we may not consciously think about proprioception, it's really essential for everyday tasks such as walking, writing, or even reaching for an object. So things that are gross motor skills and even our fine motor skills as well. It's also very crucial for brain development. So for a developing child and even a teenager, proprioception is absolutely essential to making sure that the brain is developing optimal functioning, and it's responsible for regulation and so much more. So how does this correlate to common neurological conditions in kids? Basically, when we have decreased and altered proprioception, it correlates with and connects to the four main neurological conditions children struggle with today. So those are things like autism, sensory processing disorder, ADHD, and anxiety, as well as things like epilepsy and seizures as well. So oftentimes this proprioception is thrown offline by birth trauma and subluxation. The most common insult and injury that alters proprioception and therefore all neurological control of our motor tone and our coordination are things like birth interventions and traumas, because these cause physical injury right to the brainstem, cerebellum, and vagus nerve, basically this upper neck region, which controls and coordinates our proprioceptive input, all of which leads to something that's called subluxation. So subluxation is really a fancy chiropractic term. It basically is three different parts to subluxation. It is a misalignment of our spine. It's when the spine becomes fixated, which decreases our proprioceptive input, and then that leads to neurological interference, imbalance, and dysfunction. So we can measure this with our scans that we use in our office. So while PT and OT exams will put your child through a series of movement and coordination tests to measure proprioceptive function and motor tone, we actually look way deeper into the root cause with our neurological insight scans, especially our EMG scan. So we can improve proprioceptive with our neurotonal adjustments. Once we have our neurological exam and those insight scans done, we can really pinpoint exactly where the subluxation and altered proprioception is. And like I said, with most of the kids that we take care of with these cases, chronic neurodevelopmental cases, it's that upper neck region where we see that altered proprioception most common. And then once we pinpoint exactly where that altered proprioception is, we make what are called neurotonal adjustments, which are literally designed to increase and improve proprioceptive input into the brain and specifically into the central nervous system. So that was a little bit about proprioception and how we can influence proprioception and how we can help kids that have issues with low motor tone, poor coordination, poor balance, those type of things. So if you suspect your child is struggling with any of those things and with proprioception and any related conditions, and you're not seeing as fast or complete of results as you'd like with PT, OT, and speech alone, check out a little bit more about how neurologically focused chiropractic care is often the missing link to helping these kids improve their proprioception and overall neurological development. So if you're new to following us, we invite you to follow all of our social media pages, follow us on Instagram, Facebook, YouTube. We have channels on all those. If you just Google or type in to those Facebook, Instagram, and YouTube, Pinnacle Chiropractic Sarasota will probably pop up as one of those first search results. So you can follow us on social media. If you've been following us for a while and you've been meaning to get your child in to get those insight scans that I talked about done, we really invite you to call our office, 941-822-8828, and we'll be able to schedule your son or daughter to find out exactly how we can help them. So hope you guys enjoyed this video on proprioception. Like I said, we'll continue pumping out a lot of educational videos and pumping out things that you guys can learn more about our care and educate you more on how our care, neurologically focused chiropractic care for kids, can really help with some of these issues. So once again, guys, I'm Dr. Matt Morris, and we will see you guys on the next video.